Hi, my name is Diane Goble, and I'm the author of a book called How to Die Consciously: Secrets from Beyond the Veil. I'm going to read you one of the chapters. This is chapter 2, End of Life Conversations. There is no easy way to bring up this conversation with your spouse or your parents or even a friend. Many physicians find it uncomfortable talking to patients about end-of-life treatment and care issues. Only recently have some medical schools included a hospice rotation in their programs to expose students to pain management and the dying process. Today, when physicians run out of treatment options or the patient decides no more, the physician is likely to write a prescription for hospice, and he'll never see that physician again. Generally, physicians see death as a failure, not as part of an ongoing process that still needs their attention. We all need to have some of these conversations with our healthcare team and our family before we need to have them, so that by the time we do need to have them, it is easier to continue the discussion. Mentioning this book or giving it to someone you know who is getting older or who has been dealing with an illness that has the potential to be fatal is a way to get the conversation started. Introduce it with how it helped you or a friend. If you are helping someone prepare their advance directive, ask as part of the conversation if they have thought about end-of-life care and how they would prefer to spend their last days, and if they would be interested in reading a book for some ideas to think about. This is not a one-time and forget about it conversation either. Just as our views about life and death change as we age, our thoughts about what we would want at the end of our lives tends to change as well. We might want to review our last wishes and final arrangements paperwork every 5 years, more often as we grow older or our health changes. Planning ahead for end-of-life living conditions and visiting appropriate assisted living facilities will help in the decision-making process when healthcare and caregiving for physical or mental conditions become a concern for a family member. Writing an advance directive brings up a lot of thoughts, and it can be a good time to open discussions about what people want to consider in the way of treatments and care, living conditions, caregiving, family support, and where they want to die. Once everyone has the information and the forms in hand, it is easier to have a reasonable discussion about the many possible contingencies and talk about what one will accept or not accept as far as treatment near the end of life. For example, resuscitation, feeding tubes, hydration, life support. It's even less threatening if done as a family group discussion where opinions can be aired and everyone is clear about what each other wants. There may be some strong differences of opinion about end-of-life decisions, and some heated arguments may ensue. In the end, it has to be about honoring the departing person's wishes. This is another reason to have these discussions before they are necessary and without the added stress of a sudden medical crisis. Decisions can be further discussed and refined over time rather than at the same moment life or death decisions are being made in the emergency room or ICU. Some people put off thinking about any of this until it's too late. Countless studies have shown that extensive medical interventions can make the last weeks of life an excruciating experience for patients and those who care about them. It's not just the elderly who need to have this conversation. Certainly everyone over 18 needs to consider their wants in case a life or death situation occurs. Patients need to have a discussion about their young children if one of them should become seriously ill or injured. Some people will choose to prepare themselves while they are young and healthy, so that whenever they die, however it happens, wherever they are, they will know what is going on as they are leaving their body, what options they may have once out of the body, and what to do next. Waiting until you are near death to accept that you are going to die may keep your transition experience from being as awesome as it could be. Not knowing what to do, or even that one has just died, may cause great confusion and missed opportunities to evolve in consciousness upon leaving one's body. Whether you believe in an afterlife or not, if it turns out there is, the information will be beneficial to you. If you're right that there is no afterlife, it won't matter, but you will have lived a more loving and peaceful life in the meantime. After you get a diagnosis that you have a life-threatening illness, there may be little time to learn to practice conscious dying. It's not that it takes a lot of time, only 30 minutes a day while you're learning. It's that everything else that goes with treating an illness is so overwhelming, and before you know it, there is no more time. It's one of those things better learned before you need it, so it will be there for you when you do. This is a quote from Kathy. While we had gradually acknowledged to each other that he might not make it, we'd never really accepted it or talked about what it meant. I always thought we'd have a period of time when he was in hospice care, when we would talk more and say our goodbyes. While I and my kids said lots of goodbyes and I loved yous while he was in a coma, he was never able to communicate with us again. I still replay those last few days over and over and wonder how we didn't know he was so close to the end, and wonder if he knew. A study in the Archives of Internal Medicine in 2009 disclosed that the costs of care during the last week of life were 55% higher among those who did not have end-of-life discussions with their doctors. Also, the quality of life in their final days was much worse than among those who did have such discussions. Even more important than how your estate is to be settled is what are your end-of-life healthcare choices. Studies show that 40% of people have not yet thought about advanced healthcare planning, and 90% haven't documented their wishes at the end of life. You've been in an accident. You're transported by ambulance to an emergency room. You're unconscious. Life or death decisions have to be made immediately. Your heart stops. Do you want to be resuscitated? Under what circumstances? What if there's an 80% chance of full recovery? What if it's only 10%? You're in a coma for weeks, months, years. You're in a persistent vegetative state with little hope of recovery. What would you want? Would you want to be kept alive on machines and feeding tubes indefinitely? How will your loved ones know what to do if you don't tell them or write down your last wishes and final arrangements? I sincerely hope you'll read the rest of the book and make your plans accordingly. Namaste.